Experienced pharmacist Thomas Kozge is the founder and owner of Intelligent RX. This is a digital healthcare startup located in Shakopee with a service product designed to increase access to affordable prescriptions for all Americans. Thomas has 10-year experience working in retail pharmacy and for health insurance. His passion is to help Americans afford their prescriptions so that they can get medications they need on their path to better health.
About 10 years ago, while I was working in a pharmacy, there was this lady that came to the counter to pick up a prescription. And so I went to help her, and she told me that she was picking up a prescription for her son. So when I went and I picked up the prescription from the shelf, and I brought it to her, and I told her that it was going to be $65. And when I looked at it, it looks like no insurance had been applied. So I asked her if she had insurance, and she told me that she did not have insurance. She took a moment and she started tearing up, and she told me that she couldn't afford to pay $65 for that prescription. And it was actually a prescription for her son who had asthma, and it was an asthma inhaler. If I was not able to bring that prescription down to $18, she would have been able to afford groceries for the following week. And I ran into several situations over the next couple of months, and it actually led me to start this company, Intelligent RX. So Intelligent RX is a prescription savings innovation startup located in Shakopee. Our main goal really is to increase access to affordable prescriptions for all Americans. And we just want to make sure that people are not overpaying on their prescriptions. According to Kaiser Family Foundation, more than 200 million Americans overpay on their prescriptions every single year. And there's several things that go into this. One of the main reasons is that more than 60 million Americans don't have insurance at the moment. So prior to COVID-19, there was about 40 million, but now there are 60 million. The other thing I'll show you guys down here is prices vary wildly from one pharmacy to another one. And then finally for this, several people skip prescriptions. And I can tell you guys from working in the pharmacy, every single day there's someone, at least someone who will come to the counter and you tell them the price and they say, I can't afford that. So how it works is you go onto our website, you just search the medication that you're taking, you compare prices from local pharmacies where you live, and then you're able to print or download a coupon that you can show to the pharmacy staff and save money on that prescription. This is an example of one medication that I searched, and the zip code that I used was the zip code for Shakopee, and if you can tell, for this specific prescription, you could pay $14 at Hy-Vee, $24 at CVS, and $187 at Walgreens, and that tells you how prices vary wildly. This coupon is specific to amoxicillin, which is a very common antibiotic, and if you're getting 21 capsules and you'll pay $6.66 at CVS. Without insurance, the full retail price on this prescription would be $18. So you're saving someone at least $12 on this. We make money really on referral fees. Since our website or our services are free, no one pays for them. Every time someone gets a discount and uses a discount from our website, we get a transaction fee. These other two, we haven't really implemented them. Our plan is to do some advertising, which is very targeted, and also once we have more users, do a subscription model whereby someone would pay a fee monthly and they can even get to save more money. The addressable market here is about 320 billion, but our target really is the out-of-pocket spending, which is about 65 billion in 2019. But the biggest thing that we really want to do is we want to educate consumers on really other ways of saving money. So one of the things that we are going to really do is have a blog whereby people can come and read on how to save money on several classes of medications. Also have a YouTube channel whereby we teach people on how to save on prescriptions, which no one's doing at the moment. Our growth strategy, for the most part here, we've really done marketing as directly to the pharmacies and just phone calls from one pharmacy to another one. The main thing we really want to do to expand is direct to consumer. We would like to launch some apps in 2020 Also need to get a social media presence, do some YouTube, and then finally down the road, once we have more revenue, we can do print or even TV advertising. So our coupons are used to fill about 9,000 prescriptions every month. And we are growing right now at about 6% month over month. Since we started this company up to now, we've saved Americans $1.9 million. We would like to hire more people. We are currently 4 employees at the moment. I have an account manager. We have a senior engineer who's working on the website. So we'd like to hire more people. We're really trying to empower consumers to save money. And that lady that I mentioned to you guys, I spoke to her several times after that encounter. Her name's Nancy. And every time she came to the pharmacy, she was able to pay $18 for that inhaler, and she was always very thankful.
Who pays the referral fee? I didn't follow that piece.
2 ways. So the pharmacy pays us a transaction fee to the PBM, and then they also charge a small portion to the manufacturer, and then they share some of that with us.
Today, when they go to your website and they type in a medication into your search engine, approximately, what percentage of potential medications that they could type in would you be able to provide a coupon today?
At the moment, any prescription that's available, you should be able to get a discount on our website.
How many companies like yours are they willing to work with as it relates to providing kind of these discounts? So you showed it's kind of a noisy space, but are they willing to work with really anyone?
Yep, for the most part, anyone. And sometimes the pharmacies, the smaller chains or the independent ones don't like coupons for the most part, but at least all the chains do. So if you were to go to CVS or even Walgreens, they always accept them.
I was wondering if you could talk a little bit about your customer base. And I know you had said that once you get to a certain user base, you hope to maybe shift to a subscription model. It looked like there was no user login on to access the coupon. And so I'm just wondering how you're able to track how many users are using it, and if you're getting repeat users coming back, other than the one you mentioned, right, that are finding this is great and it's going to be my go-to site I'm going to use for this in the future.
All the PBMs that we use do is they give you a report on a monthly basis that tells you which pharmacies the coupons are being used and then how many were used in that pharmacy. But our website, we are planning. We haven't started doing any as much tracking. We just need to be able to track what pages are being viewed, how many coupons are being downloaded, and all that kind of data. But we are planning on doing that.
Your biggest asset is your website. Mm-hmm. Who is responsible for the back end of your website? Is that you?
We do have one senior engineer. We need to actually hire more like a DevOps engineer that will be able to come and really improve our website. Currently, it takes about 15 seconds for you to get a coupon, which is way, way too long. We would like it to get it to under between 7 to 10 seconds.
And depending on which way the next couple of weeks go, could a policy change wipe this business out? In the sense, if they want full transparency or something like that?
It's not likely, because the way our healthcare system here works is very complex.
What's the barriers to entry? You've got GoodRx or GoodRx at that. There's you as a small startup and probably 100 more that we haven't heard about like you. Mm-hmm. How hard is this?
To improve this a little bit, we'll also add some algorithms that we can patent.